important enough to be a part of your awareness campaign. Thank you so much. Dr. Pipara, please.
Thank you, ma'am. I will request Dr. Ram Prasad Dey to deliver a welcome address from our side.
Thank you.
Yes, very good morning to all of you, particularly the principal, Madam Koili De, and the chief organizer, Dr. Soumi Ghosh, and also the coordinator, Dr. Suman Sannal, and Madam Shraddha Jain, and also all the teachers and students of the Susila Birla Girls School, and obviously my fellow and my colleagues, my seniors of the Bengal Obstetrics and Esteemed Faculty of Bengal Obstetrics and Gynecological Society. So I welcome you all to this public awareness program on behalf of the Bengal Obstetrics and Gynecological Society. I take the opportunity to welcome you all. I also hope that this 2021 Happy New Year to all of you, and expecting a COVID-free Happy New Year so that we can have a physical programs. In the beginning, I want to convey that Bengal Obstetrics and Gynecological Society is the highest level of academic body working for the women's health, affiliated to nationally the FOGSI, Federation of Obstetrics and Gynecological Society, and internationally also the FIGO. It's the old society. It is established in the year 1936, and from the inception of this establishment, it has been doing so much work, not only for the women's health. Though our primary objective of the society is the women's health, our theme is the her health is our wealth, but still we have doing so many other than physical health. Also, we are actively doing that so many social activity, as well as the so the mental health also we are always considering, and we are doing so many the public awareness programs. For the last few years, we are doing so many programs in the different college physically, but this year, due to the COVID pandemic, we are forced to do in the form of webinar or in the e-platform we are using. So I hope the students and the viewers will be benefited, and we are also happy that the Susila Birla College has also asked us to invite it, and we are many thanks once again to the principal for giving us the opportunity. And so I welcome you all, and once again thank you all to start the sessions. Thank you everybody once again. Yes. Hello, over to Madam.
Hello.
Hello. Yes.
Dr. Bashav, I will speak for a minute.
Yes, please.
I thought of the organizing this program in this very school because I was very much interested in Birla High. All my both sons are from this school only, and I'm highly obliged that Birla High School has made them a good human being. In addition to the very good, excellent academic record, they are very good human beings. So I wanted to do something in this school also. And why we are here? Because this is the age group where the girls are becoming adult women. The childhood is being converted into adulthood, and there are so many queries in the mind of the young child which she cannot ask anybody, and she goes to her close friend and both of them discuss the thing, but the friend's brain is as immature as hers is. So we wanted that let them convey a few things which them prevent from many diseases in their later life, and will them make them a strong, healthy individual with a good humanity. So we have organized this program. Will be considering the common problems and answer to that and how to prevent them. Okay, now over to Dr. Bashav Mukherjee.
Hello students, I am Dr. Bashav Mukherjee and I represent the Bengal Obstetrics and Gynecological Society. I'll be moderating this session today with you. Your online sessions have been no different, and you're not a stranger to online sessions over the last 9 months. Most of the classes have, of course, been online, and you would be very well versed with the Zoom logistics. We would just request all of you to put yourself on the mute mode, and if you want to speak at some point of time, I think the best would be to put your comments or questions in the chat box, and we will be taking it forward to the experts and the senior doctors that we have on this session. I know you have a choice of activities, and we are happy that you joined this session. And over the next 90 minutes till 1 p.m., we expect to take you through a journey about some issues in your health, some which you're already aware, some which you will be clarified. And we have with us around 7 or 8 expert doctors with us who would be taking the discussion forward. So I would be from time to time sharing a PowerPoint presentation, and then I would be sometimes disconnecting that presentation, and we would be moving on to the doctors so that you can see them as they interact with you and take this discussion forward. So I'll just start my the screen share, and then we take it from there. Yeah, so here we are. Sushila Birla Girls School and the Bengal Obstetric and Gynecological Society are bringing together the health awareness webinar on women's health, and we are all a part of this. The greatest enemy of knowledge is not ignorance, it is the illusion of knowledge. So it's sometimes that we think that we know things which actually may not be true, and that thought is the biggest enemy and not the ignorance per se. Sources of health information. Whenever we talk about health, these are programs which we do in different colleges and schools. And when we go, these are some of the slides which we start with in our presentation. We understand that people get health information from the internet. They get it from magazines, books, friends, family, the television. Medicine shops is a very big important source of information and self-belief. But unfortunately, a lot of this information is not unregulated, is unfiltered, and some of it is untrue. And so it is important for you to, it is difficult for you to understand which one to believe and which one not to believe. Sometimes what is printed in the digital media or on the books is sometimes which appears to be truth, it may not be actually the truth. And this is the reason why we are here today, to find out what could be truth and what is something about the myths and misconceptions. So what you can expect from this session, girls, I'll call you girls because all of you are the class 9 and 11, is we are here to simplify complex medical jargon. We want to cut through the medical jargon and try to get things more of a perspective which you will understand. Of course, you have biology, you've gone through biology, and some of it would be similar to what you have read. Tips on a healthy living, some of it which you already know, some of which will be banging things, especially for the patients who we see in our day-to-day clinics, in our day-to-day lives. As a doctor, we see around 25 to 30 patients, many of them of your age, and what problems they have and how they can, and what problems they have later in life when they grow up. Focus on preventive health care. We know that prevention is better than cure, and the idea is to try to prevent ourselves from having problems in the first place before you get sick or ill. Quashing myths and misconceptions. There are so many, and that's something which we really want to highlight. And again, the doctors here, the experts here will take this discussion forward. And also, of course, the answer, do I need to see a doctor? So many times, there's so many things which happen to us in our life, in our body, which we think that, chalta hai, maybe theek ho jabe. And sometimes we think that whether we really need to ignore or whether we need to approach a doctor or a medical consultation. And that is something which we'll take you for. So look for something positive in each day, even if some days you have to look a little harder. And today is a day, I think, which we can dedicate a little bit of it to health and some health awareness. So with this, we start some discussion on clinical problems. I will take you through this issue. There is a 21-year-old lady, Mrs. RS. We haven't, of course, revealed her name. She's complaining of irregular periods for the last 2 years. So menstrual periods are not regular. And also she has happened to gain weight recently. She asks you for your help. And there's another 19-year-old Mrs. SK, unwanted hair growth on her chin and face for the last 6 months. And also she's having pimples and her periods have recently been delayed. How do you help her? So this is a very important discussion. And before we come to this discussion, I think it's important to understand what on FAQs on some periods, what is a normal period? How long should a period last? Is the color of blood, if it's not red, is that bad? When should I be worried if it's irregular? Is pain during periods normal? Can I take medicines? So I'll stop my slide share. I'll bring our experts in there. We have, let me start with Dr. Ashish Mukhopadhyay. I'll ask him to unmute. Dr. Ashish Mukhopadhyay, this is a discussion which a lot of us have in our clinic with our patients. We have a lot of school students here, class 9 and class 11. Would you like to take them a little bit through what is the normal period, how long should bleeding last, and some on those issues? Yes, Dr. Ashish Mukhopadhyay.
Thank you, Dr. Bashar Mukherjee. Good morning, my dear students. And I welcome all of you in today's program, which is going to be very, very informative, educational, and we will ensure that it is also interesting for you. Now, when we are coming to the term normal period, what does a normal period mean, basically? A normal period means a normal in duration. That means number of days you are suffering. Then the cyclicity, that means every month, whether it is coming or not, or there are any gaps in the period, or there are associated any other complications during the period or immediately after or in between two periods. And normal flow, that means how much blood you are losing, basically. So these are the normal parameters of a normal period. If you try to quantify it, it will be something like a 3 to 5 days duration of period is normal. Usually a cyclicity of 1 month, 28 plus minus 2 days is normal. Then usage of pads actually defines the amount of blood loss. Normally 3 to 4 pads per day may be the upper limit, but there is one condition, that there should not be passage of huge number of clots, big clots, or a nighttime changes. So if these are there, that is not normal period. Quantitatively, 20 to 80 ml is the normal range of periods, but who measures the amount of blood loss? We usually measure it by the usage of pad. And remember, the pad, when we call sanitary napkins, we call it a completely soaked pad. It is not that just a little bit of soakage of the pad and change it, then we cannot quantify it. So 3 to 4 is the ideal. 3 to 4 days, 3 to 4 pads, and 30 to 40 ml of bleeding every month. That is usually what we call a normal periods. And of course, you can have a little bit of pain, which we think we'll come to that later on. But abnormal pain in between two periods is not normal.
Thank you, Dr. Ashish Mukhopadhyay. Can we move on to Dr. Bulbul Chaudhary? Bulbul, can you just bring in some perspectives of normal periods before we move on to what is abnormal and what is thing?
Thank you, Bashok, and we welcome all the students and the principal of the institution. So you are here just hearing that how a period occurs, what is a normal period. But one thing I like to point out, that how it occurs, you must know little bit of it. I think you have an idea that there is a ovary called there is an organ called ovary in our body, and that is being influenced by some hormones coming from pituitary that is situated in the brain. And if sometimes there is some defect or some intervention in between this path of the hormone from the pituitary to ovary, there may be some irregularity. And usually this period occurs every 28 days. This is the normal duration. But why this 28 days? Because ovum starts just maturing, and it gets fully matured by 14th day of period, if you count from the first day of the period. And after 14th day, it gets ruptured from cell, and then the hormone level comes down, and then after about 14 days, the normal period occurs. There may be little bit pain in between the periods when the ovulation occurs. That is sometimes not very much, may be associated with some whitish discharge, clear mucoid discharge before this ovulation. So this is a normal cyclical thing, like a clock. So any aberration from this clock is a little bit abnormal thing, but we'll have to discuss how much is the aberration. And I think everything has been told by Dr. Ashish Mukherjee.
Thank you, Bulbuldi. Can we move to Dr. Shaktirupa Chakraborty? Shaktirupa, I would request you to unmute yourself, please. And if you can, we've already had some discussion on the duration of the bleeding. We understand that 21 to 35 days, roughly, we say we can have normal periods. It can be a few days here, a few days there, not across generally unless it is grossly abnormal. 3 to 5 days, we have heard, is the usual duration of bleeding. There's a concern about the color of the blood. There's a concern about how irregular should irregular be to cause some worry. If you could kindly highlight those points, please. Dr. Shoktirupa Chakraborty,
Thank you. Thank you, Basho. I welcome all the students and I welcome the principal of the school. And most of the thing has been talked already about periods. And I suppose this we are talking about a person who's 21-year-old and she's having this irregular bleeding.
No, we are not talking about the case first. We're talking about normal periods. We're just trying to highlight about what normal periods are before we go into what abnormal periods are. So that's the reason why we are waiting there. Yeah, if you can just highlight that.
Yes, normal periods comes usually at the interval of 28 days, but plus minus 7 days, we accept it as normal, which has already been stated. And it should stay for 3 to 4 days, maximum 5 days. And about the pads, Dr. Ashish Mukherjee has already said. And in between, if period starts coming every 14 days or less, or even period is not coming up to 35 days, then we take it as abnormal. And this is the period. And the color has to be first day maybe little blackish, second, third day it is frank, pure red. And if it is otherwise, it either it is coming in clots, huge clots, then we take it as abnormal because blood loss is occurring from the body, which is undesirable. And about smell, if it comes along with foul smell also, it is not right. So it has to be reported to a doctor. This is beyond normal.
Thank you, Shukla. The very important points coming out there. We know that irregularity can be there once in a while, but if it's persistent and if it goes on for a duration of time, then definitely it needs some attention and some medical supervision. So I want to go on to Dr. Nirmala Pipara. Nirmala, we want your inputs here. We want to talk a little bit about the pain during periods and whether painkillers or whether can they be used. Are they harmful? A lot of people do not want to take painkillers during periods. What would you like to talk to them, and why do people have pain during periods? If you really want to, want you to highlight on that.
Pain during periods is quite normal, quite common, and if it is bearable and doesn't interfere with the normal life of the person, it is the range of normality. If it is more, and analgesics can be taken very normally, easily, and if it is relieved by taking analgesics, then also it is normal. But the pain which is not relieved by taking analgesics and which interferes with the daily life of the student, or suppose the girl is not able to go to school, not able to go to do her own work, not able to participate in the sports, then it is definitely abnormal and needs attention. Then she should consult a doctor and get a USG done to see that there is nothing abnormal in it, because painful periods are very common in a disease called endometriosis, which should be caught early. The earlier we catch, the better it is for the fertility life of the patient. So pain should not be taken lightly. Many times mothers say, "Amaro hoto, tomaro hoche." Lekin it should be relieved after taking medicine. If it is not relieved, then it definitely needs an attention.
Yeah, thank you very much. So important points which are coming out there. Pain during periods is generally common between the age of 12 to 20 when periods generally start. But if the pain is persistent and if it goes on before the periods start, after the periods end, and throughout the month, if there is a lower abdomen discomfort, then it could be a part of a disease or an illness which would require medical supervision. And also the pain which is causing absenteeism in school, where people have to be absent on 2 to 3 days a month on an average, that is something which is worrisome, which is something which needs evaluation. Yes, you do not need to have painkillers all the time. A hot water bag, a hot bath, a walk may do in many cases. But in case you need to take a painkiller, it is not a no-no. It's not that newa jabe na, nile kharab. নিলে ক্ষতি হবে সেরকম ব্যাপার নয়, you can take one or two, and if that solves the matter, then that is absolutely fine. But if with time the number of painkillers increase, the problem increases, then definitely it needs evaluation. And as Dr. Nirmala Pipara said, that one of the different diseases which one person can have and which is often detected late is called endometriosis. Thank you very much. I'll go back to the slides. I think we will, I'll start, I'll again go back with the slide, the presentation. So we had some discussion on FAQs, and this is menstruation matters. I think it's so important to stress on everybody here that menstruation is national. It has nothing to do with dirty blood or bad blood, which a lot of people say. So if your finger gets cut and then the blood which comes out is the same blood which comes out through the vagina, through the birth passage, where during the time of the periods. So the blood color, as we said, if it's dark or black or brown, that means it's old blood. It's not dirty blood, it's old blood, and it's got nothing to do with dirty or bad blood. And the menstruation myths on taboo are not true. Girls have the right to attend school even if they have periods, and there's nothing to be ashamed about. And there's an impact on daily life. So here we know that many girls miss 1 to 2 days of school on an average every month because of during the periods. There could be pain, physical discomfort. There's a fear of staining clothes, underclothes, and shame and embarrassment during periods, which is not something which should ideally happen. So we're going back to our case, the case which we discussed, and now we'll just, because we had so much of discussion in between, will bring back the discussion. 21-year-old lady, irregular periods for the last 2 years, gained weight recently. She asks for your help. And there's another case of a 19-year-old lady with unwanted hair growth on her chin and face for the last 6 months, also having pimples and recently periods delayed. So I'll stop sharing here and I'll go back to our panel. Again, I'll start with Dr. Ashish Mukhopadhyay. Ashish da, would you like to highlight here about, this is the common case which we see in our day-to-day practice in clinics. What would you advise the girls, and how would we manage such a case if it comes to you?
Ashok, before I go into the case, I just wanted to highlight one important point about the painkillers during menstruation. Okay, just if you allow me,
Yes.
just 30 seconds. That is, it is perfectly normal to have a painkiller for the pain during menstruation, that everybody has said. But one thing I would like to highlight here, that many girls perhaps don't know that the analgesic or the painkiller, if you take it just before the menstruation, before it is started, it is much more effective, and the number of analgesic also are reduced. So that is an important message. Of course, you need a first checkup with a doctor, but then earlier that you start the painkiller, better it is for you, because you remain pain-free through the periods. This many girls do not know, but then they're very scared of having medicines. Now, coming back to the cases, both these cases are two distinct examples, two definite examples, two different variations, varieties of a disease called polycystic ovary. You see, in a first case, if I remember correctly, 21-year-old girl who is supposed to have a normal menstrual period every month, like I said, 28 plus minus 2 days, or between 21 to 35 days, if you stretch it that far for 7 days more, then it is perfectly normal to have a normal menstrual cycle at this age, 21 years. But if she has started complaining of two things, one, the delayed periods, that means the periods are coming delayed, or she's putting on weight. Both these conditions will suggest that there is some problem in the ovulation mechanism. Like I think Bulbuldi said, that the ovaries are not normally ovulating this time. So there are some problems about this. And this is the first point, that the anovulation or oligoovulation, we call it. That means less ovulation. That means every month the egg is not coming out. So that is one condition, which is a characteristic of a polycystic ovary syndrome. Now, second case also similarly, when there is excess hair growth in your face, or in the areas where you're not supposed to have, your normal girl is not supposed to have this thing, that is also suggestive of polycystic ovary syndrome. So these are the two principal ways in which the cases come to us when they present with the polycystic ovary syndrome.
Thank you, Dr. Ashish Mukhopadhyay. I think I'll go back to Dr. Shaktirupa Chakraborty. Shaktirupati, you were starting to talk about the case when we went back to normal periods. Now I want you to come back in again. So these are the two cases, clinical cases, some of which we see in our clinical practice. Some of the girls attending the program today would be having similar problems, or would be knowing people having similar problems. What is your advice to them? What is your take-home message to them?
Yes, Bashu, thank you. She's 21-year-old and for the last 2 years, she's having this problem. Um, uh, uh, Before that, we have to ask whether it was coming regularly or not. And about that, she's adding weight. We'll ask her some questions that is she's having some medicines, because some people, to avoid menstruation, like there's at home there's some puja or some occasion is going to occur, they go on, over the counter, they take medicines. They don't know what high dose of medicines they are taking. And also, we must ask them that if they are having any regular intimacy with any boyfriend or not. In that case also, they start having, without understanding, they take high, like eye pill or anything. So we must exclude that. Next, we have to take a family history, whether in her family anyone suffers from diabetes. Because even if she has not yet developed diabetes, there is a gene which instills into her body and that causes her having irregular periods, etc., and also adds to her weight. So after taking all these histories, we must have to ask her to come to a doctor, do certain examinations and blood examinations, and then we'll sort out whether she's having polycystic ovary. Polycystic ovary nowadays occurs in every 10 girls. So accordingly, then we'll sort out and we'll give her some medicines to regularize her cycle. And about the hair also, having unwanted hair, there are, yes, in polycystic ovarian syndrome also, she has more of male hormone in her body. And so that, thus she has unwanted hairs. Also adrenal, there's a gland called adrenal gland. If there is any abnormality in the adrenal gland, also she might be having. So to sort out each and every problem, she must go to a proper doctor, and then her problems might be sorted out. Thank you, Bashir.
Thank you, Shukri. I think I'll go back to Dr. Bulbul Raichaudhuri. Bulbuli, one concern which a lot of girls and their parents have when they come with an ultrasound diagnosis of polycystic ovary is the fear of an operation, or the fear of something that these cysts are very damaging and harmful. How would you like to talk to them, and how would you like to allay their fears? Bulbuli, your point of polycystic ovary, the disease, and the ultrasound report, and the fear of a surgery, cysts growing big, and repeated sonography to see cyst echono ache kina, chole gache kina. Please, Bulbuli, your explanation on these things.
Thank you, Bashok. So this is a condition where there is irregular ovulation. So why this thing happens? For that, the doctor may have to ask for a ultrasonography. So one thing one must remember, when an ovum is being formed, there are about 25 to 30 ovum being growing for being an ovum. But usually all of them dies, only one thing, one ovum grows up that gives a maturity. But sometimes there may be smaller, when you take a ultrasonography, there may be that small follicles are there. Follicles mean that is not developed fully ovums. So there may be, that is not polycystic ovary. That may be that there are few follicles are not grown, and it is seen there. Then there may be that there are, if there is a polycystic ovary and there is a typical type of cyst there in the ovary, that does not, that you will be very much worried on that. One has to come to a doctor, and don't get worried. Not that we require a operation there. Usually polycystic ovary cysts are not treated by operation. They are treated by medicine, by change of the lifestyle. Most of them are seen that they are obese and not having some exercise. So we ask them to do some exercise. We have got some medicines, specific medicines, non-specific medicines. So that is the change of the lifestyle may cure the things. And it may happen that sometimes it is cured, again it may come up, because Dr. Shakti said that there is some genetic effect of diabetes, etc. So this may be recurrent. Not that one must be sure that it is not a thing for operation. It's to be treated by medicines or exercise, change of the lifestyle. I think they must be very clear on this point.
Very clear on this point. Thank you very much. That's a very important point that you have put in, that it is a medical treatment that we need to institute. There's no surgery for this. Dr. Nirmala Paper, I want to bring you in, Nirmaladi. Here, there's a lot of questions about polycystic ovary. Will it affect my future reproductive life? So a lot of mothers, of course, the girls are not so much concerned at that age, but a lot of mothers are concerned যে পরে বাচ্চা হবে কিনা, পরে প্রবলেম হবে কিনা বিয়ে শাদীর পর, and that is something which they often ask and they bring up during the discussion in the clinic. And also there's a question about, will PCO stay with me forever? ওষুধ খাচ্ছি পিরিয়ড হচ্ছে, ওষুধ খাচ্ছি না পিরিয়ড হচ্ছে না. So this is a very common complaint. So two things. So one is the future complications, especially for childbearing, and one is about the problem, or as Bulbuldi had pointed out, that sometimes you have to take the medicines for a long time, especially with irregular periods. She's off medicines, she no periods, with medicines periods. Nirmaladi want some clarification from you.
Thank you, Vasant. One thing I would like to highlight is that the lady complains of irregular period at the age of 21 years. So what I predict, she must be a college going girl, not maintaining the nutrition time, feeding time normally. So I will ask her what type of nutrition she is taking, and what type of nutrition she is taking, and how much physical work she is doing, because college girls are mostly sitting on the computers doing their studies and doing no physical work. So first thing, I will ask these students to make a lifestyle modification, take a daily walk for about half an hour, exercise for 20 minutes, and take right food at the right time. Avoid fast foods also, because if left untreated, they may interfere with their future fertility life. If they go on increasing their weight, some of the students I am seeing that at the age of 20 they are 80 years, 80 kg weight. So if they don't care and for their nutrition properly, it is going to interfere with their fertility life. And secondly, it will not stay. If they reduce their weight, if the patient lose even 5 to 10% of her weight, she will start having normal periods, because previously she was having normal periods. A lot of medicines are available to treat PCOS. So if they keep themselves under medical supervision, they will be okay, fine. And about 70 to 80% will have no fertility problem if they are taking care of themselves. So the problem arises with negligence. We can prevent it if we are careful about it.
Thank you very much. We have another expert with us. We haven't involved till now, Dr. Abhinash Chandra Rai. Abhinash da, we want to bring you in. You've been hearing the discussion that we are having in so far on polycystic ovary syndrome, and we want your inputs about what we have discussed so far and what you think should be the way forward, the cases which you've heard, and then we'll go back to our slides. Yes, Dr. Abhinash Chandra Rai for his inputs.
Yes, Basov. The thing is, in our day-to-day practice, about, say, every day we say 1 or 2 cases of polycystic ovary in my clinic and in our clinic. And I have seen the polycystic ovary cases much more in the urban area than the rural area. Whenever I go to my village in the rural area, I see the girls are going to school by cycle, and their average weight, that is BMI, is at par, normal. But here, due to some reason or fast food, the girls are mostly obese. And this is maybe some genetic cause, or mostly I think it is the lifestyle. If they take more food or junk food, there is no reason that why they're only be overweight. So first and foremost thing is to keep the body weight at par, number one. And some of the girls definitely very ambitious, and they study with computer, and physical exercise is practically nil. And this polycystic ovary in later life leads to more serious disease like diabetes, hypertension, and endometrial cancer, infertility, that. And in my experience, I have seen the obese girl in infertility problem came, I advise strictly to just reduce weight within, say, 2 or 3 kg weight loss she conceived. So these are all related with polycystic ovary, and it should be definitely should take care of their health, the girl, at the early age.
Thank you very much. Thank you, Dr. Avinash. Dr. Roy, thank you very much. I'll go back to our slides. I think we've got some discussion going, and let's just go back to where we left it there. So irregular periods, we discussed these two cases. So what we've heard from our experts, that it needs medical evaluation. It's not a surgical thing, and a hormonal imbalance is the commonest cause. And as we have heard, the ovulation being missing and the irregular hormones is the thing, needs blood tests and sonography examination, especially if it is persistent. Weight loss for the patients who are overweight, and that would be around 50% of these patients, but not everybody is overweight, remember. So if you're not overweight, there's no question of losing weight. But if you're overweight, there is a chance of controlling the problem by losing weight, which again, easy to say, difficult to do, but at the same time, always good to try. So sometimes medicines to correct the problem, there are some medicines which are available, and periodic review is likely to be necessary. You need to visit your doctor at least once in 3 to 4 months, and there may be regular evaluations with him or her, and may have long-term effects if not corrected. We have heard that from our experts. And these are some of the pictures of polycystic ovary disease, and this is how it looks in the sonography. And this is excess hair growth and the acne, which you can see and which is there. So will the cyst need an operation? The quick answer, short answer is no. Can the cyst disappear and reappear on ultrasonography? The short answer is yes. How long do I need to take PCO medicines? Depends on what the problem is. If it is irregular periods, then possibly for a long period of time, but usually periodic. If it is for some other reason, also for a long period of time, but it depends. Can PCO affect my future childbearing? Possible, but again, it depends on how much the control is. Will PCO stay with me forever? Yes, likely, but if there are no problems, then we do not need treatment. So we move on to another section of discussion in this women's health, and this section is on white discharge. So we know about white discharge, and this is, I'll just read through this uh, table here, and then we will get our experts to talk about it. So normal clear watery discharge occurring mid-cycle or just before the period, during pregnancy, during intercourse, not affecting quality of life, is what would be considered normal in most cases. And abnormal would be something where there's itching, where there's a foul smell, where it's blood stained, where there's burning after intercourse, and associated urinary problems. So I'm stopping my share here, and I'm going back to Dr. Bulbul Rai Chaudhary. Bulbuldi, we want to hear from you on white discharge, which is a very common problem when we take this health awareness in schools and colleges, which we have been doing for the last 10 to 15 years plus from this organization. And we keep on hearing a lot of questions about white discharge, and that's the reason why we put up that slide, and we want to hear from you. So your take on white discharge: when should a girl be worried? When should she show a doctor? And when should she have evaluation? Please, Bulbul.
Thank you, Bashok. So this is a very common problem. Usually so many girls are coming to us regarding with this sort of problem, that I am having white discharge. So as you have seen from the slide, that there is normal white discharge and there is abnormal white discharge. So if we see that it's a very clear, it's not itching, and if it occurs either in the mid-cycle or maybe just before the periods, or say during pregnancy, this is not to be worried. But if there is a itching or foul smelling, or some watery discharge continuously coming with foul smell, so all these are abnormal things. So one question is the hygiene of the local parts, because when there is abnormal discharge, usually there is infection. From where the infection comes? It is usually from the garments, that you have got the inner garments that are not very clean. You are not actually cleaning it properly. You are using the same thing for a long time, or you are using repeatedly the same garments. So undergarments must be very much clean and cleared. And nowadays, I think I will say much more about it, that you are using these jeans, and which are not actually cleaned. So that causes also this is a question of infection coming inside. So as such, vagina has got the power to resist infections. So there is some special type of organism that prevents this sort of infection. But if there is so much infection, every time there is infection, then it's difficult So there will be infection, and they may cause from slight irritation to much more irritation, may go up to the urinary tract infection. Or another thing, if you nowadays, all your girls of this age are usually having partners, male partners. So if you have got some physical contact with them, that may also carry infection. They must be very before doing all these things, you must consult a doctor how to take proper precaution. So these are the causes where usually local infection comes in, and not cleaning after each time of passing urine. You must clean it and wipe it with a dry cloth or with some any toilet paper, and keep it dry. Otherwise, if every time it is wet, and if there is excessive normal discharge, even then you have to change the garment, undergarment. So
Thank
this
you.
first question is the hygiene of the local parts.
Thank you. Thank you, Vibhuti. Can we come to Dr. Shoktirupa Chakraborty? Shoktirupati, we would like to bring you in here, and would like to hear from you on the same issue of white discharge. You need to unmute yourself, please.
Yes, am I audible?
Yes, you are.
Yes, yes.
Yes, this white discharge, as Bulbuli has said, in the middle of 2 periods, it is normal. And another thing I must remind, this our anal passage and vaginal passage, they are very close together. So if somebody in our country, this worm infestation is very common. So if one has worm infestation also, it goes inside the vagina, it crawls in, and then it causes white discharge. And then the other thing, so whether a person has itching or not, that is usually associated with itching. And here I must mention a point, when girls, you clean yourself after going for motion, I mean after passing stool, you must not bring your fingers from behind in front, towards your front. You should wash the vagina first and then go behind, because with that hand also these worms might crawl into your vaginal passage. So if you have worm infestation, you will have constant vaginal discharge. And if this vaginal discharge is associated with itching, foul smell, and also color change, then one has to be worried about that there must be something wrong. Otherwise, clear watery discharge in between periods, that is quite normal. And if you have pain and also burning and itching and also this color change, then you must consult a doctor. There must be something wrong.
Yep. Thank you very much, Dr. Shoktirupa. I think we'll go back to our slides. This was some discussion on white discharge, which is a very common common scenario which we see in our clinic. And now let's move to another issue which we want to deal here. It's on vaccines. So we are all talking about vaccines to save us from COVID, because COVID has been the flavor of discussion over the last 1 year. People are not talking about anything else. COVID, coronavirus, however, lockdowns, however you want to put it, has been the most searched words on Google, Yahoo over the last 1 year. So, but there is some other vaccine which I don't know how many of you have heard about, and this is something which saves you from cancer, and that is HPV vaccines against cervical cancer. To know more about it, I'll bring in Dr. Nirmala Pipara. Nirmala, we want to hear from you about this vaccine, which helps us to take care of cervical cancer. It's an HPV vaccine. If you want to tell the girls more about it, and then we will bring the slides again.
As we all know, that cervical cancer is very much common in India. Every 8 minutes, a woman dies of cervical cancer. The main thing is that there is no awareness. The people doesn't know that a vaccine is available. In some cases, there may be the cost as the factor, but usually lack of awareness is the main factor. So there are 2 vaccines available to prevent cervical cancer. One is a quadruple vaccine, the Gardasil, and the other one is a bivalent vaccine. 3 doses are to be taken One if we take first dose today, the other one is taken after 2 months and the third one after 6 months. And in bivalent vaccine, the second dose is taken after 1 month and the last dose after 6 months. How does it help? That if we vaccinate all the girls at the age of 15 years, 90% of them will be, more than 90% of them will be prevented from having cancer in their later life. Similarly, if we screen all the women at the age of 35 years, then 90% of the precancerous lesion will be screened and nobody will die from cancer. And if we screen everybody in schools as well as in the rural area, we will definitely have to train more of our staff. But awareness is the main important thing, so that they can consult a doctor, they can themselves get screened.
Yeah.
So my main aim to do this program in the school is to make the girls aware that every school living girl should get a Gardasil vaccine or HPV vaccine or whatever is available with their doctor in India should be taken. As we know that many states like Punjab, Haryana and Uttar Pradesh have started giving school vaccination program. It can be organized in schools after talking with the company people. They give some discount also, about 5 to 10% then. And in Australia, all the students have been vaccinated and they have made their country cancer cervix free. So our aim is also to make India free of cervical cancer. Now a lot of persons are having sufferings because of cancer, and we must make aware every girl, every school going girl, that cancer cervix is preventable. It can be prevented if a vaccine is taken at a proper age.
Thank you very much, Nirmalji. We have another expert with us who we haven't involved so far because she was busy in her clinic, Dr. Bipasha Sen. Bipasha, we want to take your inputs of this. We are talking about cervical cancer vaccines. We're talking about HPV vaccine. We heard from Dr. Nirmala Pipara about the importance of vaccine. If you would like to highlight on that, please.
Yes, thank you, Bashar. Actually, what Dr. Nirmala Pipara has said, it is 100% true and relevant that we should make these school children aware of the cervical cancer vaccine first. And we all know that it can be given to women of age group 9 to 45 years. And if we give the children of, the girls within 15 years, we need only 2 doses of the vaccine. 2 doses of vaccine will do, and the immunity will be stronger. But if we give it beyond 15 years, then we have to give 3 doses. And yes, not only cervical cancer, these quadrivalent vaccines actually give protection from vulval warts and some other vulval.
Low.
I think it's a poor network connection.
Link.
Am I audible? Am I audible?
Now you come back again.
Okay. Okay.
Yeah, so we just want to share the slides again. So we'll go back to the presentation which we were showing there. So, and then I'll again have some more discussion on cervical cancer vaccine, sorry. So just a minute, sorry. Yeah. So yeah, here we are. So, so this was the first slide, and we were talking about Jane Goody. If you, some of you know, she was a celebrity who had a fight with Shilpa Shetty in the Big Boss, I think, which was in the UK, and then she came, a Big Brother in UK, and then she came back for the Big Boss here in India, and then she had to fly back because she was diagnosed as cervical cancer, and she soon died. So just to get you in perspective, this is something you have read in biology. So this is the part of the uterus which is called the cervix, which is one of the areas where cancer can take place. And this is the injection which we are saying, which prevents it. This is what Dr. Nirmala Pipara had said. 1 Indian woman dies of cervical cancer every 7 minutes. This was in 2016. Now it's 8 minutes, and it's time for us to change that statistics. And one way you can do it is by taking this injection. So you wait for your turn of COVID. Less than 18, they're not giving COVID. So most of you will not have a COVID injection anytime soon. But this is something which is between 9 to 45. 3 injections, as was said, after the age of 15.
Some network problem.
Before 15, 2 injections, earlier given, more effective. So if you give it at 9, 10, 11, 12, it's more effective than you give it at 40, 45, much later. So earlier given, more effective. Intramuscular shots, like this, very similar to the COVID shots which they're showing on television. So either it's a 0, 1 or 2 and 6 month schedule. So 2 injections over a period of 6 months, more than 70 to 80% efficacy, no need for boosters. And FAQs on vaccines. Where can I get vaccinated? You can get anywhere vaccinated where the doctor is keeping stocks, because it's not available over the shops. It's available at retails. So the doctor can organize that, or some hospitals sometimes keep vaccines. So you need to find out who has it. It's either with some doctors or with in a hospital. How much does it cost? It's roughly around 3,000 rupees per shot, and that's 3 into 3,000, that's 9,000. What are the side effects? The side effects are minimal. It's mainly local, a little bit of pain, a little bit of irritation, then it'll go, hardly any fever. Age best for vaccination, as we said, 9 to 15. Which vaccine to choose? Whatever you can get hold of, I think that's thing. Before we go on to the next discussion, I want to bring a little bit more of this vaccine discussion. I want Dr. Ashish Mukhopadhyay to come in the picture. Ashita, we want your takes on this, or can you unmute yourself, please? Your take on this, on the cervical cancer vaccine, please.
Yes, thank you, Bashab. And girls, I think you have recognized the area called cervix, which Bashab nicely showed in the slide. Now, unfortunately, this area cancer, cervical cancer, is the commonest cancer in our country. And a lot of people die, as Nirmala said, 1 in 8 girls, women, they die out of cervical cancer. Now, the problem is that the cervical cancer, the cases, when they come to us with the doctors, it is already too late. That means it has already spread it too far inside the body. And that is why the death rate is also very high. And that is why so many women are dying. So there is one vaccine, one simple vaccine, which actually solves all this problem, because it actually kills the virus, which actually causes this cancer. That is why the virus is strongly recommended, particularly in our country, in all the countries where the cervical cancer rate is very high. And everybody has told you about the vaccine. It is not ordinarily available. It's not over the counter that you go and just buy it and get it a shot there. It's not possible. But you have to talk to your doctor. The doctor, I want a vaccine. I heard that there is a vaccine against cancer. This is the way you should approach. Like all the vaccines that you have taken, like in the childhood or even up to the entering into the school age, etc. Just another time to remember that apart from COVID vaccine, there is another vaccine which is so very beneficial for women. And previously the age range was 9 to 26 years. Now it is extended up to 45 years. So anytime you can take the vaccine. The logic behind is the earlier you take it is better, as Dr. Bashab Mukherjee said, because it is ideally taken before the sexual debut, and therefore it is very important to take it earlier, and it remains effective also. And as Vipashadi also said, that before 15 years you have to take 2 doses, and after 15 years you have to take 3 doses. So you save some money also there. So I think all in all, the vaccine is a very useful instrument in our doctor's hand to prevent a lethal cancer, a mortal cancer, बहुत ही खतरनाक cancer है ये cervical cancer, the cancer of the cervix. I think it should be recommended to all school-going children or school-leaving children.
Thank you very much, Dr. Ashish Mukhopadhyay. Dr.
Bashab, I want to add little.
Please come in. Yes,
vaccine is a very nice thing and should be given to all children, all girl child, and if not men. But thing is that one must be knowing that what is the cause of cervical cancer so long. That was the early child bearing and early marriage and promiscuity. All these things, they must be avoided. Only vaccine will not do. This lifestyle changes on this point should also be highlighted. Absolutely. That one must allow this promiscuity is very much common nowadays among the young ladies and boys and all. So this is a point that must they understand, that they should take proper precaution. Even if they have taken the vaccine, they must just follow the normal lifestyle, not this abnormality.
Thank you, Bulbuldi. Dr. Abhinash Chandra Rai, we want your inputs.
Yes. Yes.
And I would,
yes. Yes, Bashab, just to impress the girls that Nirmaladi has said about the incidents in our country. But if you consider throughout the world, every 2 minutes, one patient is dying of cancer cervix. And the thing is, in Bengal, usually we used to tell in the earlier age, the cancer means no answer. But in case of cancer cervix, yes, there is answer. And that is the vaccine. And tragic part is that the cancer cervix death, the woman dies at the younger age. That is at the age of 40 or 45 or 50, leaving behind the young children, son, daughters in the very important age. So it should be taken seriously. And as because it is not given in the national immunization schedule, but in individual, each and everybody will try their family to take the vaccine as early as possible from 9 to 45 years of age. And as already said, if it is taken within 9 to 13 years, so only 2 doses is sufficient.
Absolutely.
Thank you, Basha.
Thank you very much. So I think it's very important to get a few perspectives here. The one is that about this cancer, cervical cancer, what we generally want to talk about is that this is for prevention. There are other things for screening. There's of course a lot of treatment, but this is prevention. And as we have focused in the beginning of this talk, of this session, that prevention is better than cure. And this is something which would have a primary prevention to prevent the cancer from occurring in the first place or from developing in the first place. Nirmaladi, I want to bring you in here. We talk about champions in our FOGSI thing, about Yuba champions. In this school, we have got a champion here, and she's passed on a message. I'll just read it out for you. She's a class 9 student, and she runs an organization called Shebel, which spreads menstrual health awareness and distributes menstrual products to underprivileged girls. So whenever she says, whenever she tells the girls from the shelter homes or rural areas that they should not be afraid to talk about their periods and should maintain proper hygiene, they often do not understand. They do not give importance to hygienic conditions during menstruation, even though we have tried to explain to them the repercussions of such a lack of hygiene. So she wants to ask us how to reinforce the importance of menstrual hygiene to these girls from the underprivileged girls, which she's taking care of. We are very proud of Anvesha Saraf. So Anvesha has sent this message directly to us, and this is the work which she is doing as an NGO, I would say, and this is on menstrual health. God bless you, Anvesha. I think you should continue the good work, and we will be there to help you. After this program, in the last slide, we'll share you a lot of phone numbers and emails. Be free to collect them and contact any of these experts who you are hearing now. In case you want to be in touch with them in any form and in any form, then they will definitely be happy to help you. So we will be sharing a contact detail list at the end of this program, and please be free to get in touch with us. But Nirmaladi, she has a problem about reaching out on menstrual hygiene awareness to shelter home girls. And what is your, how can she do it better? What is your advice?
Actually, the main problem with these girls are they are not able to buy the pads and they don't understand how to use it. So if we visit once or twice there personally, make them understand that these pads require change every 4 to 6 hours, and there is a soap like shampoo available for cleanliness which should be used daily, especially in the days of menstruation, and that can prevent them from a lot of diseases, vaginal infection, and then that can have a healthy lifestyle. Then definitely everybody wants a better lifestyle. So if we make them understand in their local language about the good points of pads and why not to use these old-fashioned cloths, and even if they are using or persisting to use old-fashioned cloths, and how to make them sterilized by drying them in sun or ironing them, then they will definitely follow. It may be the lack of proper counseling, they are not able to do it.
I think this is something which is very important, because even though you try to explain a thing to a person, they may not always understand it, or they may not always may not always gel. The same thing happens when we talk to our patients. Sometimes in their good interest, we try to explain to them things, but either they do not want to understand because they have some other knowledge in their minds, or sometimes they fail to understand because they are not intellectually, or their education background may not be that appropriate. So I think the idea is to continue reinforcement, never to give up, to continue your good efforts, and definitely they will pay healthy dividends in the long run. One important discussion, just because we're talking about it here, yesterday I was speaking to one of the leaders who has a society of menstrual health awareness in India, and she was talking to me about something they call sustainable menstruation, something where they're talking about using more of menstrual cups and biodegradable pads. And the reason why they're saying is that because menstrual pads or menstrual tampons and menstrual sanitary napkins have become a huge source of waste, of which is often not biodegradable. And that's another issue, another discussion. We'll save it for some other time. And let's go back to our slides and let's go back to our discussion. So here we are. This is the next, the last of the issues which we wanted to highlight here before we take more questions and wrap up. So these are the different sort of reactions which you can have to your body. I wish I was skinny. I am too skinny. I hate my big butt. I am too fat. My chest is too big. I am too short. I hate my fat stomach. I am too flat chested. I wish I looked like her. I have fat thighs. I hate my body. So body image, why can't I be perfect? So that's what our last section of discussion would be before we wind up this session and we have more questions or discussion. So here we have some case scenarios for you girls. Miss PK is ashamed that she's just 4 feet 10 inches tall. Her other friends in her peer group are well over 5 feet. She feels it may be difficult to get a groom. Miss RC feels lowly in front of her friends as her breasts are very small in size, and she finds it difficult to concentrate on her studies as this plays on her mind. Miss SD is a mediocre student, while her elder sister was a brilliant scholar and a gold medalist. SD gets upset as her parents and teachers at school keep on giving her the example of her elder sister, and sometimes she even feels that life is not worth living. So we do come across some of these scenarios in, again, day-to-day life, because a gynecologist can be a very good friend, not just of the patient, of the family. And sometimes they come to us with problems which are beyond medical problems. And this is something which is beyond medical. They want to share it to somebody, and often the doctor becomes the perfect friend. So at these sort of scenarios, how do we deal with it? I'll again stop sharing and go back to our experts. I'll start with Dr. Bulbul Roychodhary this time. Bulbuldi, this is something which we want you to start with about it, and we'll hear from everybody about how body image plays on the mind of the individual, of the girls who are attending this seminar, and what we can do and how we can change the thinking here.
Thank you, Vashal. So this is the common thing, that there are different types of people. Somebody is fair, somebody is black, somebody is brown. So there may be long height, maybe short height. So many, somebody having a small breast, somebody having very big breast. So these are all problems, but these are not problems. See, God has made all people differently so that you look different and you can love each other. If everybody is same height, same texture, same everything, then I think the world would have been dull thing. So this height short or small breast, this should not be taken so seriously. This is a short height. This is something maybe little bit genetic factor. So you should not be feel ashamed. If you can score in other sides of your life, then it is no question of this short height or something. And regarding the small breast, I like to share one thing, that even if the breast is small, the normal milk secreting organs, the hormone not hormone, I mean milk is secreted from the glands in the breast. Breast is composed of glands and fat. So if the glands are okay, then the patient, when she is pregnant, she can, and after delivery she can feed the baby properly, even if the fatty portion of the breast is less, but and the breast looks small, but this will not hamper his normal breastfeeding. one must think in that way. That, and another thing is, if the breast is small, regarding the shape of the body, they may be feel, but there are certain operations done, certain things are available who can lift up your breast, but that should be taken on fully under advice of the surgeons. Not, you should not take it, think that everybody can do it. If there is real necessity, then only this can be taken. And regarding the intelligence, everybody is intelligent, but somebody may have some acumen in some teaching, somebody may have acumen in cooking, somebody may be in playing. So there are different types of work they may achieve. So does not mean that my sister is very nice, in very good, very intelligent, why I am not. You should not be ashamed for that. You have got other parts, you can do that, you can develop those things, whichever. You may be a singer, you may be some instrument, you can play some instrument. So many other things are there, so many things, so you can develop in those and I think this advice to the seniors also. This our habit in the family, that we will say, oh, your sister is so good in academics and you are not that. So this is not the way to tell to a younger one, that will depress her. Rather, you encourage her that you have got other parts, you develop those things. I think these are the things we must think before bringing up a child, how to shape their mind.
Thank you, Dr. Ashish Mukhopadhyay. Let us hear from you. You deal with a lot of students, of course, medical students, not students of the school, but of course, you would face some similar problems, and a lot of people mentally would be thinking in these same lines. So let us hear from you. You're talking to students of class 9 and 11 here. What would your advice be on these issues, which sometimes plays very importantly on their mind and makes a very big impression on them?
Yeah. Thank you very much, Basha, for bringing in this very, very interesting and very important topic for discussion. That body image factors. I mean, the body image thoughts in the girls' minds. I will give you each one of these problems one example. Suppose the girls who are very short in height, or rather short in height, they have some complexes. They should think of icons like Sachin Tendulkar. If Tendulkar was not playing cricket for the height that he had, then we won't have got a Tendulkar. Secondly, the second problem was that of a small breast. I think Bulbuldi has explained it in detail, that it is not any deformity or a defect. It is just the absence, lack of fat, which I think it will grow over time and it will have a normal thing. And today, I think these problems we are facing a bit less, because, you know, the problem of a small breast, we used to face it before. Nowadays, they have understood, seeing all the celebrities all over the world who are not really concerned about the size of the breast. It's just an organ, and it develops in time, with time, and therefore it will not cause any problem in your growth, development, reproduction, whatever it is. So that thing has to be cleared in somebody's mind. And the third one is the academic excellence. Yes, there is a point, but I think the point is in the parents, not in the children. That they're expecting academic excellence just because our elder sister is brilliant in academics. If we expect the same thing out of her, as Bulbuldi said, it's wrong. And I will give you the example of, you know, our one of our presidents of the country, one of our prime minister. They are not so educated. They are not academically brilliant, but they have reached the height of their performance. And therefore, I don't think that we should give these examples and encourage the girl, so that the other things that they have, like somebody is very good at singing, somebody is very good at drawing, somebody is very good at craft work or other works, I think that should be encouraged. The main thing lies in the environment where she lives. The people around her, the parents, the teachers, I think the teachers have a great role in playing that. If you feel sometime in the class that one of the girls is having some complex issues about the body image, I think you should talk to her separately, explain to her that things are possible in life. Life is an endless game, and you can excel in so many things. Do not focus on these unnecessary things. And today's girls, I think they know better than what we used to face before. So I think that the problems can be easily solved, and there are no abnormalities associated with any of the problems that you have mentioned here. It is just a body image thoughts, the thought process in your mind. That's what.
Thank you, Dr. Ashish Mukhopadhyay. Dr. Nirmala Pipara, we want to get your thoughts here, because this is something which is so important. And we want to get all of the thoughts of all of our panelists on these issues. Just a minute.
I would like to speak here 2 lines.
Yes, please.
For all the ailments under the sun, for all the ailments under the sun, there is a remedy or none. There is a remedy or none. If there is one, find it. If there is none, don't mind it. So my message to all the students is, don't look at your body image. Try to find out that what is your image. Can you help it? If you cannot help it, don't mind it. There may be whatever may be your height, someone may be too long, someone may be too small, someone may be too fat. If you can reduce, it is okay, fine. If you are trying and not able to reduce, then don't mind. But you should have a positive outlook towards your life. Don't think negative things around you. Even the roses have thorns. So always be scentful. Smell is very important in life. So be there like a rose. Don't look at the thorns. So my message to all my dear students is, have a positive attitude towards your life.
Thank you, Nirmala. Very, very positive message there. I will just have a last couple of slides before we wind up and take the last final concluding remarks. So how serious issues, I'll bring you in, Ashita. Just to finish this part and I'll bring you in. How serious are the issues of the body and mind in young adults? I think we did understand that this is very serious and we really have to address it. If the person wants to talk to somebody, you can be that shoulder to discuss it. How can we counsel them? Yes, some of it can be done by doctors, some by counselors who are the best person to talk to them. Sometimes people who are very close to them, but they should be knowing what to talk about and how to approach the subject. How much is the society and demands of the society responsible? Yes, often we expect too much from ourselves. Often we put ourselves in a pedestal where we think that we are the best, we demand the best, and that is sometimes which is the root of all these problems and things. What are the red flag signs to consult a psychiatrist or psychologist? Now that is very important. That's very serious. When a person becomes socially withdrawn, when the person doesn't come out, when the person is absent from school on a regular basis, always depressed mood, not interested in things around, suddenly has curled up in his own environment. These are times when you must have sometimes medical help, because those are not very good signs. They could bring up signs of suicide, and there should be other things of self-harm, which is something which we have to be aware of. As friend circles, as peer groups, everybody should be aware that all your friends are moving through this journey of life all together, and these upsetting things which may happen from time to time has to be tackled and has to be taken care of. Would peer group or support group discussions be helpful? Yes, and sometimes they can. Before I wind up, I would be taking parting thoughts from everybody, but here is the contact details which you should be looking at. So we have a website of www.bogs.org.in, and that is something which you have for the Bengal Society. And this is the email if you want to get in touch with the society. And on YouTube, we have a recording of this entire program where you have to type in BOGS School Public Awareness Program on YouTube, and you will be getting a recording of this. And this is the list of the faculty who you were just now seen. Dr. Bhaskar Pal is our president. He was not here today, but Dr. Ram Prasad De, who was the secretary, is the one who gave the introductory remarks. Dr. Avinash Chandra Rai was there. Dr. Ashish Mukhopadhyay was there. Dr. Nirmala Pipara was there. Dr. Bipasha Sen made a brief appearance. She's in a clinic. Dr. Bulbul Rai Chaudhary was with you. Dr. Tulika Jha was busy. She could not attend today. Dr. Shaktirupa Chakraborty was there for a significant amount of time. And I am Dr. Bashav Mukherjee. So thank you. We stop here and we take...
Bashav, one thing.
Yes, we take...
Regarding body, few words regarding body image.
Yes, please.
I want to tell the student that there will be only one in his class, in her class, only one first. And nobody will be considered like I am Suchitra Sen. That is 2. Third point is regarding breast during the pregnancy and lactation. There is lactation, there is every chance of developing the breast up to normal size. So there is nothing to worry. Our ambition is to establish in the life in our country and to give the best of service.
Thank you.
That's all.
Bulbuldi, we want to have some parting remarks from your end. What are the take-home messages you will be leaving to the students here?
Thank you, Bashop. These are all the students are very nice, I think, in their mind and they are everywhere. But we have to explore their mind, and we must be very, very friendly. And to the teachers and or to the doctors, I am telling that everybody must be very friendly to our these young girls, so that they can express all their problems to us very freely, and we can show them their right path, and also in the health and also in the question of mind. So both sides should, we the doctors and the teachers should be very familiar and friendly to the students, so that they can open up their mind.
Absolutely. I think
Thank
we
you.
agree with you strongly, Dr. Ashish Mukhopadhyay. Let's bring you in. Let's get your parting messages to the students before we end this session.
Yes. Thank you, Bashav. I'll just take 2 minutes to spread 3 important messages. Number one, remember that all cysts are not operational cysts. I think there is a lot of problems in the student's mind, that the girl's mind, that the cyst means something which has to be operated. And remember, cyst and polycystic ovary are two entirely different things. And polycystic ovary cases, most of them are treated with lifestyle modification, exercise, and then medicines in that order. Surgery comes last, if at all. So that is my message about the cyst. Number two, all whites are not abnormal. As correctly mentioned, there are some normal white discharges also, which you need to know and not be panicked about the white discharge that is happening, that is odorless, there is no smell, there is no burning or itching sensation, etc. You have to bear with that because that is normal. Number three, I would like to congratulate the little girl Anesha, class 9, who has spreaded this issue about this menstrual hygiene. It's a wonderful, job by wonderful work by her. And I think I will just leave 2 or 3 messages about usage of sanitary napkins. Apart from the fact that it's a non-biodegradable product and we are coming out with a better substitute of it, in the meantime, till it comes in the market, we have to spread some messages. Number one, do not overuse your sanitary napkins. That means don't keep it absolutely wet and then you change it. That will cause problems. Number two, do not underuse your napkins, because that will cause more problems in counting the number of pads, and then you'll be a representation of a wrong message to your doctor. And finally, about this body image, I would just like to mention that one disorder which is coming up, as you said about the red flag signs, one disorder that is coming out very strongly today in the adolescents, young girls, is ADHD, attention deficit and hyperactivity disorder, which is so common nowadays. I think all the teachers know about it. And the earlier signs of ADHD have to be carefully found out in a student and then referred to a psychologist or a psychiatrist. But remember, there are very minimum cases who actually require the referral to a psychiatrist or a psychologist. And most of the time, the peers, the teachers, the parents, in that order. And finally, we are all here to help these girls for their bright future, irrespective of whatever they have in their body image defects. Thank you.
Thank you. Dr. Avinash Chandra Roy, are you there?
Yes, I'm here.
Can we bring you in here for your parting comments and take-home messages for the students? And then I'll be.
Can you see me? I'm audible.
You are audible. You cannot be seen at this point.
Why? It is written D. What is the reason?
Because your video is not on.
I'd say yes. Once again, I am to tell the same thing. Number one, in this budding age, there will be the future citizen of our great country. The thing is, everybody in their class is not fast. So there should be difference. And everybody, if they imitate like Suchitra said, cannot be. So what God has given you, try to cultivate it. And regarding our contribution in this presentation regarding to make your health very nice and healthy life, so that you can live a healthy life. And this was our utmost effort from our society. And we have tried our best to give you the best suggestion. And your teacher will and guardian will also give you the best suggestion. Thank you, Basu.
Thank you very much. So we just have parting comments from Dr. Nirmala Pipara. She is the one who has organized this from Bengal Obsgyne Society and coordinated with Sushila Birla Girls School. Thank you, Dr. Pipara, for bringing Bengal Society again to this school awareness program. We're coming to the end of it, and now we want to hear your parting remarks and your take-home message for the girls.
From my side, take-home message is that every girl should develop a healthy lifestyle, try to maintain the optimal weight, take proper diet, fruits and nutrition, cut off fast food from their diets. I'm not saying not to take it, but take in a limited amount, give proper attention to their teachers and studies. And if there is any problem in their mind, if any query in their mind, they should consult their teachers and not their friends, so that they will be rightly guided. They can consult with their parents at home also, and they should feel free, friendly with everybody who are available nearby. They should not think only in their brain and keep silent, and otherwise they will develop depression. Everybody should have a healthy lifestyle. This is my message to them.
Thank you, Dr. Nirmala. We have back with us our Secretary of Bengal Obsgyne Society, Dr. Ram Prasad De. Dr. Ram Prasad De, thank you for joining us again. And just to some the parting message and a vote of thanks from your end, and then we'll ask a representative of the school, either our principal or a teacher, to please give a thanks and just to give a comments on the topic. So, Dr. Ram Prasad De, please your vote of thanks and parting remarks here, please. You're not audible.
Hope I am now audible. Yes.
Now you are. Yes.
Many thanks to all of you, particularly our principal madam, as well as the chief coordinator, Dr. Soumi Ghosh, as well as the faculty of our esteemed faculty from Bengal Obstetrics and Gynecological Society for beautifully organizing this women's health public awareness programs. I also thanks to the students who have actively participated, and also the hope such type of program the students will be benefited. Once again, thanks to all of you. And the take-home message regarding the topics have been already told by our esteemed faculty. I only thanks my congratulations and thanks to the from the behalf of the Bengal Obstetrics and Gynecology.
Thank you.
Yes. I will like to thank Mrs. Renu Bhuvna. It is her dream image that this program has come true.
Mrs. Bhuvna, you can unmute yourself, please, and you can give some comments from your end, please.
I can say that I am very lucky to have been associated with Dr. Pipara, I think over 40 years now. And she has guided me. When I had a baby girl, she was my doctor. And when she told me about this cervical cancer, I think about 5-7 years back, she had one of these programs and I had attended it. I am a biology teacher, but believe me or not, I had not heard of cervical cancer at all. And she enlightened us. And then I spoke to her, and then she vaccinated my daughter for this cervical cancer. And I feel blessed today that she guides us regarding gynecology, if there is anything like that. And today she's not here, she is in the US. But I know that she is safe and sound there, at least with these kind of problems. All this, I don't have to really worry, because all this was done before she left the country. So under her guidance, under her shelter, and I feel all of y'all are very important to society. And I thought if you could just one bit touch on the marriageable age of children, because I have a girl of 25, 24 plus. So, you know, career, education, children, marriage, you know, this has become quite a confusing thing as to, should I wait till she has a career? Should I wait till her education is over? If it is late marriage, what will be the effect of all this body problems? You know, this is little confusing for me as of now, because I have a daughter of 24 years, but you are talking to girls who are very young now.
That's the reason why we didn't touch on that topic, Mrs. Bhuvna, because biological clock, which you're really talking about, how long does your fertility last, and marriage, and we didn't touch on those because we didn't touch on contraception or abortion, because those are the other issues which we take when we're doing a college program. But as it was a school program, those issues, I think later Nirmala Di will get in touch with you about this.
Yeah. or if you can talk to the JD Birla College girls once. JD Birla also falls under the SK Birla group. And I was a student of JD Birla, and I taught there for 12 years. I was a lecturer there. And I think these college girls, if you talk to once, touching upon cervical cancer also, because, that's again a very big awareness for our children. And then again, talk of the points that I have to clarify.
Thank you, Mr.
I think that will be very nice. And maybe we can work it out with Dr. Pipara.
Thank you very much. Thank you very much. Nirmaladi, last word from you.
I'm very thankful to everybody, especially Principal Madam Koili De, main organizer of this program, Dr. Shomi Ghosh, coordinators, Madam Suvarna Sanyal, Mrs. Shraddha Jain, and whatnot. No thank you to Renu Bhuvna because she is a very friendly to me. I think that we have done it out of our own interest. I wanted to organize one program in the school, and a big thank you to all the students who have participated and make that program a successful one.
So thank you again, everybody. And as I said, there is a YouTube recording for people who are interested, people who have missed, or you want to go through some of the points which was discussed here. We tried to make it as student-friendly as possible, trying to bring in case presentations and questions and some things which we see in our day-to-day life, which would be pertinent to you and your health. Thank you very much. Stay healthy, stay safe, and we sign off here from the Bengal Obstetrics and Gynecological Society. Thank you all for